He was a mythic figure and therefore difficult to divine. The man who defied the orders of the White House and the threat of oil, or rather jail, to publish the Pentagon Papers, the secret history of the war in Vietnam, revealed the lies told about the war. And that was hardly the only crisis, journalistic and financial, through which he protected and steered the Times. My father was not prone to worship, but he worshipped Arthur Sulzberger. Some of my sweetest memories of him were the weekends when we visited his family's estate, Hillendale, in Connecticut. One night, I spent an incredible hour talking to his mother, Iphigene Oakes Sulzberger, whose father had brought the failing Times, or bought it in 1896, determined to produce high-quality, dispassionate journalism at a time when newspapers were openly partisan. I wandered around the edge of poolside parties where the guests my father assumed were very important people. They served great fried chicken. But most fondly, I remember the nights when Punch would screen a film in his small theater. The publisher of what I was quite certain was the best newspaper that ever existed seemed to take as much boyish delight in the ritual as I did. Private insurance companies should be leading the way in the struggle to control health care costs. They know about every contact a patient has with the health care system and can see how much a wasteful or redundancy can have hurt. By altering the way they pay doctors and hospitals, they can potentially push providers to reduce costs, improve quality, and even transform the whole culture of American medicine. For the last 3 years, Blue Cross and Blue Shield of Massachusetts, a private non-profit insurer that is the largest in the state, has been using an innovative approach that takes on traditional fee-for-service health care, which has long been the most costly way of paying for care and the least subject to budget curbs. Under a new kind of contract, the insurer puts many of the state's largest hospitals and physician groups on fixed budgets and rewards, or punishes them financially based on their performance in meeting the budget target. The results from the first 2 years of a 5-year contracting period are quite encouraging, and this strategy is spreading to other places. More than 225 healthcare provider organizations around the country have entered into agreements with public or private insurers for some form of budget-based contracts, and Medicare has started demonstration projects, the Blue Cross model, with 32 organizations. Under fee-for-service, which still dominates American medicine, insurers pay doctors a separate fee for each office visit, test, or procedure they perform, giving doctors incentives to do more rather than less. Under the Blue Cross approach, groups of doctors and hospitals, the vast majority were previously paid on a fee-for-service basis, have chosen to enter alternative quality contracts which pay them a negotiated total sum to provide all the care their Blue Cross patients will need over the course of a year. The groups range in size from 8,000 members to 165,000 and together cover some 640,000 Blue Cross members. The contracts do not allow the insurer to dictate what specific procedures or tests can be performed These doctors are left to the doctors who do what they think best with the resources they have. If the medical groups came in under budget, Blue Cross rewards them with a share of the savings. If they exceed the target, they absorb part of the loss. The goal is to cut the annual growth in spending by half in 5 years. The danger is the fixed payment, also known as a global payment, that doctors might be tempted to deny patients care to keep costs below the target.
So sad.